So from Bhishma to a method for interdisciplinary scholarship. Let's talk about that. Talk about the methodology, which is I think, an important segment of this discussion. The preceding discussion follow one life through formation, commitment, and fulfillment. Their unity lies not in a scientific theory attributed to the Mahabharata, but in a method. Textual observation is established before contemporary interpretation, and interpretation culminates in a question rather than a claim of proof. This approach avoids two symmetrical errors. Anachronism treats modern constructs as though ancient authors formulated them in contemporary terms. Dismissal treats literary observation as irrelevant because it is not experimental evidence. The proposed framework occupies a disciplined middle position. Literature identifies and preserves phenomena. Philology and history. Philology and history constrain interpretation. Modern science supplies constructs and methods. Empirical research determines whether a hypothesis survives. Bhishma's formation raises questions about breadth of learning, mentorship, oral retrieval, adaptive expertise, and later life teaching. Commitment reveals interaction of identity, public reputation, persistence, leadership, and flexibility. Fulfillment foregrounds agency after severe injury. Preference, sensitive care, pain and meaning, generativity, sacred time, and dignity. Contemporary science often studies these topics separately. The longitudinal narrative situates them within a single biography and therefore encourages research into their interactions over time. For neurology, the manuscript I'm going to work on a manuscript and send it out for publication. And this work, I think, directs attention beyond impairment. Clinical practice regularly encounters profound disability after stroke, trauma, neurodegeneration, neuromuscular disease, and chronic pain. Mechanism and prognosis remain essential, but they do not exhaust the clinical task. Identity, communication, agency, relationships, purpose, and contribution influence what recovery and care mean to an individual. For medical education, Bhishma provides a longitudinal case rather than an isolated dilemma. Learners may revisit early formation after seeing the later consequences of identity and commitment. They may examine how admired virtues become constraints, how disability coexists with authority, and how teaching itself becomes a form of legacy. These complexities are more instructive than a predetermined moral lesson. For medical humanities, the framework extends close reading toward hypothesis generation while retaining the irreducibility of meaning. Irreducibility of meaning. Neuroscience investigates mechanisms. Narrative preserves experience, ambiguity, and temporal continuity. Their collaboration is productive only when neither discipline is used to subsume the other. The methodological contribution can therefore be stated independently of the Bhishma's interpretation. The methodological contribution can therefore be stated independently of the Bhishma interpretation. The Sanskrit narrative to scientific hypothesis framework is a 6-stage auditable process for converting a culturally situated literary observation into a researchable question while preserving disciplinary asymmetry. Textual scholarship determines what the narrative can responsibly be said to describe, what the narrative can responsibly be said to describe contemporary science determines the validity of modern constructs and methods, and neither domain supplies evidentiary authority for the other. Bhishma serves as the proof of concept rather than the limit of the method. The framework also establishes criteria by which future applications may be judged. A strong application should be textually locatable, philologically defensible, historically contextualized, behaviorally explicit, scientifically referenced, operationalizable, falsifiable, and ethically appropriate. A weak application will typically fail by omitting source verification, collapsing Sanskrit concepts into modern terminology, selecting only confirmatory evidence, or presenting resemblance as discovery. These criteria allow the approach to be replicated, criticized, and improved across texts and disciplines. So what are the limitations? The Mahabharata is a layered literary, philosophical, and theological work rather than a contemporaneous clinical record. Bhishma cannot be diagnosed retrospectively, and extraordinary narrative elements cannot be converted into physiological evidence. The modern constructs used in this work, expertise, cognitive reserve, executive control, professional identity, patient-centered care, successful aging, and dignity, are analytical lenses rather than translations of Sanskrit concepts. Similarity does not establish historical priority or conceptual equivalence. Translation remains interpretive. Terms such as dharma, pratigya, brahmacharya, anurupa, jnana, buddhi, and prajna have semantic ranges that exceed the scope of the single English equivalent. This is another challenge, the difficulty with translating Sanskrit into English, because there are not exact words in English for the layered meanings, for the meanings of the words used in Sanskrit. Jal, pani, toy, they're all water, but they have different meaning, different context, preferred in different situations for use. Okay, selection bias, that is unavoidable. The manuscript foregrounds episodes that support the formation, commitment, fulfillment architecture. Other domains, including reproduction, yoga, genetics, public health, statecraft, gender, and additional theological material, are not treated comprehensively. The hypothesis remains untested. Their merit depends on feasibility, operational clarity, ethical design, replication, and the quality of future empirical work. But where do we go from here? Bhishma's life may be developed into a longitudinal educational case for physicians and trainees. Unlike a single ethical vignette, the case would permit learners to see how early education and public decisions shape later responsibilities, moral conflicts, aging, disability, and death. Educational benefit should be measured rather than assumed. The methodology is transferable but not universalizing. Comparative work may include other figures from Sanskrit, Buddhist, Jain, Greek, Chinese, Shakespearean, and other modern literary traditions. The goal would be to identify culturally specific observations and examine whether the modern biomedical categories require refinement when confronted with different accounts of autonomy, resilience, wisdom, and good death. The most credible research program will require collaboration among Sanskrit philologists, historians, clinicians, psychologists, neuroscientists, gerontologists, palliative care scholars, ethicists, and medical educators. Each discipline should both constrain and enrich the other.